Hello, my name is Patrick Joynt, and I'm presenting this poster on behalf of myself and my co-authors, the Department of Pediatrics, Section of Emergency Medicine at the University of Colorado School of Medicine, CI International, Colorado Pediatric Preparedness for the Emergency Room, and Emergency Medical Services for Children, Colorado. It is entitled State Trauma Designation and Pediatric Readiness. The National Pediatric Readiness Project assesses the degree to which emergency departments are ready to provide emergency care to children and is currently conducting its second edition of the survey. Higher scores have been associated with improved outcomes for critically ill children, and trauma designation may be a proxy for pediatric readiness. We sought to examine the relationship between state trauma designation and pediatric readiness in Colorado emergency departments. This was a secondary analysis of the 2020 National Pediatric Readiness Project pilot assessment in Colorado. We excluded pediatric-specific facilities and a single Level 5 facility for too small a sample size. Outcomes were stratified by trauma designation level. We examined the weighted pediatric readiness score and certain specific pediatric readiness metrics. 88 hospitals were surveyed, 76 responded, 6 were excluded, and thus 70 were included for analysis. 6% were level 1, 14% level 2, 30% level 3, 39% level 4, and 11% not designated. Of note, 60% reported seeing 5 or fewer pediatric patients per day. Trauma designation level was positively associated with a median weighted pediatric readiness score and some specific factors. 42% of hospitals reported having a disaster plan, 88% of which included pediatric-specific considerations. This study is most limited by its small geographic and numeric size. State trauma designation is common knowledge, but pediatric readiness is not, especially in states without a specific approval program. Further research is needed to explore which readiness factors are associated with improved clinical outcomes for children. Ultimately, we conclude that the highest levels of state trauma designation, notably level 1 and 2 in Colorado, may be a proxy for pre-hospital transport destinations for children. Thank you for your time.